I'm Kathleen Lisson. I'm a certified lymphedema therapist and board certified massage therapist, and this is actually the part of all my videos where I say we're here in my studio in San Diego, but I'm actually here in Doris Torres's business, which is Skin and Skinnier. Her husband is Dr. Steve Torres, and he gives liposuction and Brazilian butt lifts to people with like low BMIs. He calls them the skinny BBL, which is awesome. It's taken off in the past, you'd say 2 years? 2-3 years?
Really, probably about 4 or 5 years. It's been, busy, but we've only been in La Jolla for 2 years, a little over 2 years,
Yeah.
But before that, we were in Scottsdale, and we've relocated here, the whole family.
Yeah.
Yeah.
It was really exciting. I actually met your husband once before the pandemic.
Yes.
And that was because one of his clients called me, found me on the internet, called me, and then I had an appointment with her. And then I always send a massage therapy care plan to the surgeon, and he called me up and he's like, Kathleen, how much work do you need? And I was like, this is great, because he was like, we recently relocated here, and he saw the difference that it made in the client, the lymphatic massage, and kind of how I operate my side of it. So I usually, if you watch my YouTube channel, you usually see the post-op side of it, and I give a lot of advice, but I really want to, as the pandemic is ending, hopefully in the next 6 to 9 months, I want to talk a little bit more and reach back up the supply chain and talk to some of the plastic surgeons in the area and kind of get their feedback on how we're doing, what we can do, what we do better, and how get some insight that I think me and all my therapists want to know on like what happens to our clients before they come to us, and how these top plastic surgery practices operate their businesses to get such a great result from their clients. So we started with some questions, so we'll just kind of go over the questions with Doris. Well, do you want to, let's take a step back and kind of tell me about like your vision for the business and why you're here.
Yeah, so I'm a people person, and I think it shows. I'm not on our videos very much on our social media, but I'm usually the one behind the camera. But to me, going into a surgical procedure is something that is not only physical, but it's very much emotional as well. And I'm an emotional person, and I'm very much in sync with people, and it's because I'm a people person. And so my focus here at Skin and Skinnier is really to make sure that you're taken care of as far as the patient, that you're in the right state of mind to go through this procedures. We sometimes get patients that my admin staff kind of alerts me and says, we're not sure, there's some red flags, we want to make sure this person is really okay with everything. And I usually reach out to those people and want to make sure that they've had their consultation with Dr. Torres, but I want to make sure they're really okay with moving forward and they're 100% on board, because that's really what it takes. It is a 100% commitment to your body and to your healing process and to your mental state, and it is toll taking.
Yeah.
It is not an easy peasy type of surgery.
No.
Yes, it is done, in an ambulatory setting, but the recovery is can be intense depending on how you're handling it, and a lot of it is up here. It's mental. And that's why I want to make sure people are in the right state of mind, they're in the right frame of emotional setting, and they can handle it, and they do it for the right reasons too. That is really important. So my job is really to introduce myself to the patient ahead of time so that they have a direct point of contact, and by extension to Dr. Torres, because if there's something I don't know the answer to, I had one this morning, I said, I really don't know the answer, you better call Dr. Torres in the office.
Yeah.
Because that's over my head. I'm not a medical professional, and I know my limitations, but I have helped hundreds and hundreds of patients post-operatively, so I really understand the process, I know the ups and downs, and it's just critical to really be in the right mindset to move forward with it. Sometimes it's better to postpone. If you're trying to fix a relationship with a BBL, it's not going to work. It's just the wrong reason. So we want to make sure that you're really in in it for the right reasons. So my job is to also introduce myself ahead of time, and then also really working with the patient post-operatively, because as you know very well, everybody heals completely differently, and some people heal very fast and others don't. They have a sluggish, lymphatic system. They might have some underlying health issues that they weren't even aware of, and there's a lot of factors that come in. I think a big one for me is emotional support, and I can't be it all. So you have to have at least one person that you can rely on for emotional support during this, whether it's your best friend, whether it's your spouse. I don't care who it is, your mother, a good friend, anyone that you can trust 100% and that you can kind of vent with too. And because you will have some moments where you're like having, surgery remorse, where you're like, why did I go through this? This isn't even, I look worse than I did before the surgery right now. And it's a common theme that I do experience with my patients sometimes, that they're like, I shouldn't have done this. It wasn't the right thing, and then usually they bounce back, and they recover from that. It's temporary, so I just help them get through those moments and help them really stay positive, and that is really key to it all, knowing that it is a process and it takes time, and people usually do really well after a few weeks. Some people do great after a week.
I think that's so important. So I've been studying the topic of my next book. Obviously, we were laughing before about how we're always researching stuff. So the next book that I'm writing is going to be on adverse childhood experiences. It's as a result of a huge Kaiser study a couple of decades ago in San Diego. Noted that the toxic stress that results from adverse childhood experiences is seen at a public health level with some of the top chronic diseases that we have, chronic illnesses that we have. You can trace it back to how many adverse childhood experiences they had. And one of the things that they've seen is, because then the first question is, well, like, I grew up in a tough home, but like someone else grew up in a tough home too. Like, why are some people not seeing that toxic stress and those issues with the adverse childhood experiences? And what they found is it was the presence of at least one loving adult that they were able to see that was a source of safety for them. And so as I read this stuff at home, and then I go to my office during the day, and it's reflected in what you said, like, you need that one person, and it is Doris, but it can't just be your Doris. Like, you have to have
available.
that. But you have to have at home that one special person that is in your corner. And it's very interesting in plastic surgery, even versus I also would take care of people as an oncology massage therapist, as a lymphedema therapist. People can be much more open with their oncology surgery. Like, when you have cancer, all of a sudden, like, people's arms are around you. There's support months for different types of cancer. Like, you feel in the community that there is a support, and there is someone within your family that will understand that you have cancer, and then this is a time that they should step up and support you. But so often in plastic surgery, people are trying to hide that because they're scared of the judgment. Exactly. So count yourself lucky if one of your friends told you before they had plastic surgery that they were having it. The amount of people that I've seen that are in professional, so these are adults and they're in professional work relationships and environments, and they're like, what can I wear to help me hide the whole thing from everybody? Because I'm not going to tell anyone I work with, so that's like all your work friends. So you're dwindling down to these tiny group of people that would even be possible to be your support system. But you need one. I would highly recommend, like, you need to rethink the plastic surgery if there's not one person that can be your emotional support at
Absolutely,
home.
I totally agree. It is so important.
And the other thing that you mentioned that I really like that I've seen, and this is with like lymphedema, with lipedema, with oncology, with every type, and with plastic surgery, is like, if there's something going on at home, like, that is you could still get through it, but that you have to know you're not going to be like at this 3-week totally recovered. And I even, like, it's one of the things that I even, like, it makes a tagline. Like, you can only renovate one thing at one time. Do not renovate your kitchen at the same time as you're renovating your stomach. Because, like, the amount of people, like, it's almost, if you tell me that you're redoing your kitchen, like, ka-ching, I know that we're going to be friends now and you're going to have to come in. Like, if there's a stressor in your life that you're undergoing, but the realistic part, if there's a stressor in your life that you're undergoing, you need to give yourself compassion. That your body can only handle so much. Like, your mind, your emotion, you can only handle so much. So what's going to happen is your body's going to, like, help you to overcome whatever emotional thing you're doing, and your treatment, your recovery is going to take a backseat. And you have to love your body and say thank you for allowing me to handle all this at the same time, and not, like, be like, why isn't my lymphatic system responding? So why are, you know, am I still bruised? Why am I not healing so fast? It's because you have, I mean, the amount I've seen people, and I will absolutely come and have your lymphatic massage, but if you have a lot of stress in your life previously and things aren't working so well, and you're white knuckling through life, where, like, as long as everything goes right that day, you can make it through. But if, like, one thing gets twisted, then your whole schedule is in shambles.
Exactly.
You're not going to heal that fast.
Yes.
Not as fast as your friend that has more resources.
Yeah, and I think one thing too that I notice a lot is that, you know, we have a lot of young patients. So I would say at least half of our patients are, well, actually probably, well, half of our patients are probably between 25 and 35. And if you have a patient that's 45, that patient is not going to heal as fast as somebody who's 22. Or whatever. And so they compare themselves too much to other patients on our page, and that's another danger zone that I'd love to talk about, is that, you know, they come in and come with inspo pics, and they would like to look like so-and-so, and like this person or that person, and their body, it's absolutely impossible to get them there. But then they kind of almost get depressed because they didn't achieve what they thought, and so having the wrong expectations can really be difficult, not only in terms of the actual results, but in terms of the recovery itself too. Like, if they're not allowing their body to be healing and, you know, patting themselves on the back and saying, wow, this was intense, this is some trauma to my tissue and all that, and it just takes time to heal. And if they're too unforgiving of themselves, I think that is, sometimes I just have to remind people that they need to just relax and let their body heal. And that's one of my messages that I text to them too, that I say, well, you just really give yourself time to be okay again and recover fully.
You know what I say? I have something I say, because I like to get a laugh out of people, and sometimes if you tell someone something clinically, like, they take it clinically, and then if you tell them something like real life, like your friend's gonna tell you, then they laugh and they understand and they get it. So if someone's like 45 and we're like, why can't I recover like I did when I was younger? And I was like, how's the liquor drinking happening for you? Because when we're 23, like, I can drink like 2 glasses of wine and a gin and tonic, and then I can, like, go to sleep for 6 hours, and then I can get up the next day and function at work. But, like, what would happen if I tried to do that now? So if your body can't take the liquor drinking anymore, then, like, how are you expecting it to somehow be just as, like, are you still running the 15 miles that you did, you know, and then being, and not, like, feeling sore the next day, just, like, getting up and, like, invincible. It's great. When we were 23, we were invincible. Because we were so stupid, we were making a lot of stupid life decisions. And now that we're older, we have to be wiser. And usually when they're like, oh yeah, that's right, yeah, like, I can't even, like, I drink 1 glass of wine and I'm, like, going to sleep at 10 o'clock. And I was like, yeah, because your body's, like, not letting you, it doesn't put up with any of that crap that you're doing to it anymore.
So true,
So that's, that's the big thing. Like, people just have to have realistic responses. And at the same thing, like, you can't go to the facelift guy with a picture of you know,
someone else,
like someone from the Mickey Mouse Club, and expect the result. So like, don't go to Dr. T with a 22-year-old body if you don't currently have a 22-year-old
yes,
body.
exactly.